I would say that Ozil has brought fun back to the practice. I love going into the OR. It is something completely different, something that I'm doing that gives me joy. I go there and I see things that make sense, that I know that I'm doing a much more efficient surgery. I can see when I have that fragment of nucleus up at the tip of the phaco, I can see exactly how it performs, and I can see how it just, boom, it's gone. Okay, so we start with our paracentesis. This is 1.1 incision. Okay, now we're gonna make our little groove, and we're gonna go in through the stroma and into the anterior chamber, creating a 2.2 millimeter incision. We're going to be using 100% Ozil. This is a very dense nucleus. Right now we're using Discovisc as our viscoelastic, deepening the chamber. One of the great things about microcoaxial is the fact that you can keep the same instruments you were using before, the same Utrata, the same forceps, everything that you used before. You really do not need anything. Through that 2.2 incision, you're able to really do all the maneuvers you were used to before. This is a very hard nucleus, so we will try and divide it into as many pieces as possible before emulsifying it. It's very important, especially with this kind of nucleus, to free it in the capsular bag, to get it loose. Since this is a very hard nucleus, I will use a very sharp chopper in order to produce the first quadrants. That is a milky substance that you see due to the ultrasound to the Ozil. And now it's very important to get as many pieces before going to quadrant removal, and making sure that that crack is gone all the way down in the center. Now this is a very sharp chopper, so now that I have 4 quadrants, I will change and I will go for a blunter chopper so that I don't risk. There we go. Now that we have 4 quadrants, I will go ahead and each of these quadrants, go ahead and divide them into 2 each. Now that we have enough pieces, what we'll do is we'll go to position 2, and each of these pieces is going to come easier because we have so many of them. First we bring the first one up, and we'll try and tumble it and go from the periphery in. As you see, I'm constantly in position 3 because that's what I want. The torsional is much better, works much better if you have the piece of nucleus at the front of the tip. and always go from the center inwards. And as you can see, this is a very, very hard nucleus, and as long as the piece of nucleus is up against the tip of the ozil, you will be able to get a very much better effect. And as opposed to longitudinal ultrasound, with the longitudinal ultrasound, what you would normally do in a case like this, for example, is you would look to embed, wait for the vacuum to go up, and then press position 3. That is something you do not want with Ozil. You want to put it there and go straight to position 3, and you see how it completely disassembles that nucleus. Now, in order to remove the rest of the cortex, I'm using a silicone INA tip. Very capsule friendly, very easy to maneuver, manipulador común. We'll be implanting an IQ lens which will go through the same 2.2 incision. You don't have to put the whole cartridge in, it's just the lip of the cartridge has to go up against the wound, and it's very, very easy to just have that lens go through that same incision. Now we're going to be first removing the viscoelastic from the anterior chamber, and once we have that removed, Discovisc is very, very easily removed. We will get underneath the lens without pressing on the pedal. Quietita, mi amor. And move the lens, get underneath, and press position 1. Once we're in position 1, the chamber deepens, and we are able to get all that viscoelastic out. We move the lens into position. We have now a very firm eye, and we're going to make sure that the incision is sealed. And as you can see, that is a tight wound, and we're not having any kind of filtration. It's just much more efficient. The patients are happier. You can do it through a much smaller incision, so you induce less astigmatism. Your patients are happier the next day. Your corneas are much more clear. Doesn't get much better than that. So I'm really loving this